Heat stroke is a medical emergency, is a life-threatening situation, and up to 80% it's deadly if left untreated. The victims of heat stroke. In this training session, we will cover the signs and symptoms of heat stroke and how to treat or give a first aid to a patient who is under the attack of heat stroke. So let's get started. The signs and symptoms of heat stroke are headache, nausea, dizziness, confusion, fainting, loss of consciousness, seizures, skin is red, dry, and very hot, sweating has ceased, pulse is strong and rapid, very high fever, 105-degree Fahrenheit, maybe disoriented or in the state of possible convulsions. Dear friends and colleagues, every year there are hundreds of deaths during work, games, or even exercising in the result of heat stroke. This is the warning sign. Heat stroke is a killer, and maybe me or you is the next victim. Heat stroke doesn't occur all in sudden. There are some warning signs. First of all, our muscles are affected. As temperature rises, they feel like a hot poker is pressing against them. As the temperature rises further, the air you breathe feels like it is coming from a furnace. And no matter how hard you try, you can't get enough air. Stop exercising, stop working, and leave the task incomplete. Take a break and drink fluids. But if you continue, your body temperature will rise further and affect your brain. Your heart will start to hurt. You will hear ringing in your ears. You will feel dizzy and may have difficulty seeing. And the next step is unconsciousness, and you will be on the ground in just a few seconds. So be smart enough when you exercise or working. Know your limits and drink plenty of fluids all the time, especially during summer. After discussing the signs and symptoms, after talking about the warnings, let us start discussing how to treat the heat stroke patients, how to provide first aid. The number one and the most important point is seek and get professional medical attention or care immediately. Heat stroke is not a fun or joke. It needs the proper treatment, attention, care, observation, and facilitation. Number two, move the worker to a shaded, cool area, loosen clothing, and remove personal protective equipment. Number three, cool the worker quickly with a cold water bath, but remember, keep the head out of the water. Or wrap in wet sheets, cold compresses to the head, neck, and groin. Wet the skin. Place cold wet clothes on skin or soak clothing with cool water. Number four, circulate the air to speed cooling. Number five, don't try to give oral fluids if the worker seems sedated or has slurred speech. And number six, don't give medication to lower temperature. It's not a normal fever. It is the responsibility of the medical staff that what kind of tests, examination, or medicines required for that victim. This is based on the exposure and the condition of the patient. And that's all.